In the 1980s, a dramatic shift began to occur in the practice of wound management. The new paradigm of moist wound healing, moving away from traditional gauze dressings for chronic and hard-to-heal wounds and burns, brought with it faster healing times, less scarring, and fewer infections. The basic principles of moist wound healing drove product development, and the dressings that led the industry then, hydrocolloids, foams, alginates, and hydrogels, have not changed materially since that point. Along the way, new technologies such as silver antimicrobial dressings and silicone-based adhesives added to the arsenal of products wound clinicians had at their disposal. However, control of bioburden does not provide a magic bullet in helping chronic wounds to progress to healing. No single antimicrobial dressing or technology is appropriate for all bioburden management issues, and limitations of absorbent dressings continue to frustrate both clinicians and patients. And that's why we at Dermasciences have been working so hard to understand the science, technology, and process of wound healing and the management of wounds, and we've been making great progress. So let's talk a little bit about chronic wounds. A wound becomes chronic when it doesn't repair in an orderly and timely process and doesn't show a sustained anatomic and functional result. It is estimated that there are approximately 7 million Americans that now suffer with chronic wounds, and that number is expected to rise more than 1 million each year. And of those 7 million Americans, approximately 50% of those patients will suffer with stalled wounds. Generally speaking, stalled wounds are those that typically do not heal at least 15% in 2 weeks. Let's take a look at some of the most common wounds that you are dealing with on a daily basis. If you do not see at least a 19.5% reduction in the size of a pressure ulcer in 1 week, it may not heal in a timely fashion. If you do not see a venous leg ulcer healing at least 30% in 2 weeks, it is probable that that will not be healed at 6 months. Likewise, with a diabetic foot ulcer, if that ulcer has not healed at least 30% in 2 weeks of treatment, there is only a 9% chance it will go on to healing in 3 months. So what causes a wound to stall and become chronic? The presence of necrotic tissue, non-resolving inflammation, bacterial colonization or infection, high levels of proteases, impaired perfusion and the decreased tissue oxygenation, oxidative stress, systemic problems such as diabetes, autoimmune disease, cancer and cancer treatments, other typical and atypical skin disorders, and recurrent physical trauma. Dermasciences' full line of advanced wound care products are designed to not only address the common demands of moist wound healing, but also to address the specific needs of the patient's wound environment and progress it through the healing process. So let's take a look. MediHoney is the global leading medical-grade honey-based product line for the management of wounds and burns. These unique dressings contain active leptospermum honey, a unique honey from New Zealand that has beneficial plant-derived properties. The dressings can be used in all phases of wound healing and could be considered a key dressing in any wound bed preparation protocol. Honey has been recognized for centuries for its medical properties, but MediHoney with active leptospermum honey is unique and indigenous to a specific area in New Zealand. It is sourced, tested, processed, and prepared under the most stringent international controls and specification standards, and sterilized by gamma radiation to eliminate spores and contaminants. We encourage you to find out more about the specific modes of action and clinical applications for MediHoney in our video series. Be sure, our sourcing and processing standards and the evidence supporting the use of MediHoney sets these products apart from other honey-based dressings. Whether for debridement or for the management of challenging wounds, MediHoney is increasingly relied on by clinicians around the globe for its improved outcomes and cost-effectiveness. Here's another product with a difference, Extrazorb. One of the reasons wounds stall is because they don't have the proper environment. Wound fluids, along with harmful MMPs and bacteria, are allowed to stay in the wound bed, creating maceration and preventing healing. Extrazorb doesn't allow that to happen. Because of its patented superabsorbent polymer technology, it not only absorbs the fluid and harmful components, it locks them in a gel pad, keeping them from leaking back into the wound bed. Additionally, due to the superabsorbent polymer, ExtraSorb dressings absorb 2 to 4 times as much fluid as conventional dressings. This further assists in improving clinical outcomes, requiring fewer dressing changes and providing more comfort for your patients. ExtraSorb dressings represent a dramatic change from the common absorbent dressings that have led the industry for over 2 decades. Wound infection is a major problem today. Over 500,000 surgical site infections are treated annually in the U.S. Deaths from MRSA have passed those of HIV and AIDS, and the costs of these infections are staggering. That's why it's important to focus more attention on preventing bacteria from entering the wound area and inhibiting its growth. BioGuard does both. Its active component polydadmac, a cationic biocide that attracts bacteria, binds with it and disrupts and destroys cell wall structure. There are other cationic biocide dressings on the market, but here's the BioGuard difference. Polydadmac is up to 100 times larger than PHMB, the active component in competitive dressings. This increased size prevents bacteria from developing a resistance to it even over long exposure. It also allows for the dressings to maintain their activity even in challenging wound environments and when used along with other wound management products such as Dakin solution and enzymatic debriders. Importantly with BioGuard dressings, the active component is intrinsically bound to the substrate, so it doesn't leach away from the dressing. Leaching allows for a zone of inhibition to form, which is another factor in resistant strain formation, and also has toxicity implications. So for infection prevention, BioGuard offers a line of safe, effective dressings. No wound care product line would be complete without a silver antimicrobial dressing, but of course Algicel AG is another product with a difference. Silver is an ancient remedy that has undergone a resurgence in the past decade. The particular dressing efficacy, however, depends on a number of factors: the type of silver compounds used, how long its antimicrobial activity lasts, and how much it absorbs. With Algicel AG, DermaSciences addresses each of those factors powerfully. Its silver is in the ionic form. This allows for a longer-lasting, slow release of silver from the dressing. Its antimicrobial activity starts almost immediately and stays strong for over 7 days against a broad spectrum of pathogens. It absorbs from 16 to 32% more wound fluid than the market leader, reducing maceration risk and dressing changes. And it has an optimal gelling profile, gelling while maintaining its physical integrity. This allows for it to be non-adherent to the wound bed, removing easily and minimizing any fibrous residue left behind in the wound. All wounds are not alike. Especially if they are chronic or stalled, they need to be treated specifically for their etiology, presentation, and severity. Wound science has made quantum leaps in recent years. With the uniqueness and utility of MediHoney, ExtraSorb, BioGuard, and Algicel AG, DermaSciences is playing a leading role in wound management technology. DermaSciences' commitment to advanced wound care starts with you, the clinician. Our mission is to provide you with superior products that address every stage of your patient's therapy and the clinical support and education to ensure our full line of advanced products are addressing your wound care management needs. That's why we've created this series of videos along with other educational materials to help clinicians in their desire to advance the practice of wound management.